Welcome to another edition of Back Talk, brought to you from the Southeastern Studios in Mount Pleasant, South Carolina. Each episode, you'll hear from board-certified physicians as they explore the latest in medical procedures that are now helping get more and more people out of pain and back to their active lives.
We're back here at the Southeastern Spine Institute podcast, talking now with Dr. Richard Frisch, who's an orthopedic spine surgeon. How are you?
Doing well yourself?
Yeah, doing as well as I could be after a long day. What Dr. Anderson and I have been talking about here lately are advances in spinal surgery, things that have been game changers. He pointed to minimally invasive surgery, that is surgery done through smaller and smaller incisions, and then disc replacement. One of the things that you specialize in is doing a certain kind of surgery, which we call a lateral lumbar procedure, where you can actually go through the side of the spine. You want to tell us about that?
Sure. So lateral fusion is just a different approach to access the spine, typically for a fusion surgery. And it's a concept that's been around for a long time. And there's a Brazilian surgeon who really kind of popularized it probably 25 years ago. And it's kind of taken off in the United States.
Dr. Luis Pimenta.
Dr. Pimenta, yes,
right.
Now in San Diego. So, and it's my interest in it came in my training and my background initially was in the type of spine surgery, which was for scoliosis in adults. And traditionally, that's a very difficult surgery. It's a surgery that can have a difficult period of time for people to recover from. And so one of my interests is along the last 15 years or so have been how to do that surgery through a less invasive approach that's does not have as many complications. And so that's how I really got interested in that procedure, because it allows you to really limit the amount of surgery that you have to do for those surgeries. But that approach can also apply to single level problems and more common degenerative problems that people experience as they're older. And what's good about it is that it allows you to save the tissues around the spine, so you're not having to cut the muscles in the back. And so it's a very powerful procedure in that way. So you can achieve a goal often of fusion, which could be a large, fairly difficult surgery to go through, and make it a much easier surgery to tolerate.
Right. I don't think a lot of patients understand that when we do an operation and go through, as you call it, the back or posterior, and you make an incision in your back, you actually do the cutting with an instrument that we call a bovie or a cautery, which is some people also call a hot knife, right?
Mm-hmm. Sure.
And literally what this does is it sears or almost fries the muscle off of the bone. And if you don't do it that way, you get into a lot of bleeding. And so when we take the hot knife and cut through the muscle, it really sears the muscle almost in a morbid way, like searing a piece of meat. As graphic
Smells
as
like that too. Yeah.
Right, it does. Yeah, it does have a certain odoriferous quality, and that's one of the advantages of the lateral surgery. Right, you don't use the hot knife, you don't use the bovie.
That's right. It allows you to dissect through the muscles, not cut the muscles from the attachments. And really, that's kind of a principle of all minimally invasive surgery, and it certainly applies to the lateral approach. And so you're preserving the muscles and allowing them to maintain their function.
Right. And although we're not obsessed with time in surgery, that time is important in surgery, especially for these, I'll call them bigger operations where you're removing a disc and replacing a disc. And sometimes when you go through the front or the back of the spine, it can take a good while.
Yeah, I agree, particularly as patients that as we get a little older, it's definitely more difficult to undergo an anesthesia. Patients who have comorbidities or other illnesses. I'm often asked, is being a fast surgeon important? And I don't think being a fast surgeon is important, but I think knowing how to efficiently get through a problem with causing at least damage to the spine was stressing the body a lot, because a lot of patients, you go under anesthesia, if you're under anesthesia for several hours, there's a lot of effects that it has on your whole body, your heart, your lungs, your kidneys, as you well know. So if you could have an approach that would say take a surgery that historically maybe is 3.5, 4 hours, it allows you to perform that surgery in an hour, not because you're racing through the surgery, but because it allows you an access point to perform the same goals through a much quicker, less morbid method, then that's obviously an ideal situation.
Right. Well, anyway, the lateral approach has changed spine surgery. You know, I did the first ones in South Carolina 25 years ago until I've gotten officially too old.
Black and white photos, yeah.
Right. Yes, the black and white photos. I've gotten officially too old for it now. It's kind of a physical surgery, isn't it?
It can be. All spine surgery can be physical, and particularly if you're looking at doing a scoliosis surgery, sort of traditionally how it's done, those can be, 6 to 8 hour long surgeries. It can be long surgeries where patients who you have an option to do a lateral surgery can significantly reduce the time of surgery, which is good for the patient. It's good for the surgeon as well.
Right. And so when you do this surgery through the side, getting them ready to do the surgery sometimes takes longer than doing the surgery, doesn't it?
It can. Yeah, there's a lot of positioning involved in how you set the patient up, and really a lot of the work of the surgery is done before surgery by just because of how we use the X-ray during surgery and how we position the instruments to place the graft. And so we've spent a lot of time. Obviously, I learned a lot from you over the years, and have maybe run with it a little bit since then, and have had a lot of opportunity to be involved in developing and advancing the surgery. And so really, it's like anything else, the preparation is probably 60% of the surgery, and then once you've got that, it really makes it a very good surgery to do.
Right, you're being modest when you say you've advanced it a little bit. You've advanced it a lot. One of the things I think is remarkable about the lateral surgeries is that there's so much input involved with getting the patient in the perfect position. We do a certain thing to monitor the patient's nerve functions during the surgery. And so people don't realize this, but they have electrodes placed in their arms and on their legs and through their spine to measure the signals that go through their body that allow you to do the surgery through these small incisions and stay away from the nerves, right? I think that so many people have an impression that in an operation it's just you and an anesthesiologist and a scrub nurse, and there's three people in there. My gosh, for some of these big operations, the room is 10 times as big as this room, and there's 20 people in there, right?
Yeah. It takes a team of people to do it right, and you have the anesthesiologist, the nurse anesthetist, the scrub nurse, the circulating nurses, the assistants, C-arm techs, which are very important. And so you really need everybody to be involved, and everybody's very important. We're very fortunate in the situation that we have, that we have great people around us for a long time, and it's really helped us perform these surgeries consistently well.
Right. It's just a matter of almost repeating the same steps over again, like doing musical scales, right? You've just got to stay with that repetition and that almost discipline to do the surgery through the side like that. It is clearly something that you've got to follow protocol and do it right, or else it can go sideways.
Yeah, and if you do it right and you prepare right, it becomes very easy, but it takes a while to kind of figure out how to do that.
We hope you enjoyed this edition of Back Talk and learned something new. Look for other podcasts from Southeastern Studios as we explore the latest in medical procedures that are helping more and more people living in pain get back to their active lives.